Okay guys, today we're going to talk about how I take care of my scars. In one of the groups I'm in, they were asking why my scars look so good. So I'm going to talk, we're going to do two things. We're going to talk really quickly about wound healing. I'm actually going to do another video about wound healing specifically because it is calm fears, because I think what happens is the normal process of wound healing and you get afraid when it's just the normal steps our body takes. And I'll talk to you about what I mean by that. So in one of these, the next video I'll go a little bit deeper into it so you can understand, why is it getting dark at this point? Why is it getting red? Why does it seem like it's getting more raised? And then we'll talk about the things that you can do, especially if you have hypertrophic scars or you keloid, the things that you can go see a dermatologist for, or you can even do at the house. Even if you don't have hypertrophic scars, you still want to be able to have the best outcomes that you can have. And so on the next video, we'll talk a little bit more about that. Specifically today, because I'm getting ready to do my own taping on my breast lift, I want to talk about the type of silicone that I use, why we use silicone treatment, and we use silicone treatment, how to get it cheap and how to use it and how to save money doing it. Okay, so the first thing is this silicone comes in a roll in a small box. I'll link it, the one that I really like, just because you can get more bang for your buck. You can even use this if you're using, if you've had a tummy tuck. We'll talk about when you should start using it and how you should use it, okay? Of course, always check with your doctor. You want to follow, your doctor's instructions. This is not meant for medical advice, blah, 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 blah. These are the things that I use, and based on my own research from what I do for a living, it's just things that I know work, okay? So, but always follow the advice of your medical doctor, and this is not medical advice, it's just what I use for me. All right, so the first thing I do is you're gonna stand in the mirror, you're gonna look center of this tape over your nipple, and you wanna start using this after the tapes come off and your incisions have somewhat healed. For that, some people can start using it if your body rapidly has re-epithelialization of that skin tissue. Some people can start using it at 11 days. I was not healed enough, and I had quite a bit of puckering around the nipple, which is normal, by the way. So I had to wait a few weeks before probably around week 4, I could start using silicone tapes, okay? So the best thing for you to do is to ask your surgeon, have them look at your wounds and say, can I start using my tapes, okay? There are very expensive silicone products out there. Some are called Embrace, where it has the nipple part attached to like a T part on the bottom. They're expensive. And the problem with that is they're not contoured to fit your breast. And so I recommend that you do use a tape like this where you can make your own. First of all, it's cheaper. Second of all, it works just as well. Third of all, it's going to fit you. When I first started getting tape, I would go around the nipple and I would cut a piece here and cut a piece here and cut a piece here and cut a piece here. This is the way you can do it if you buy this thick, wide tape. Now, there is another tape that I'm going to link that is a clear tape. I did not know about that tape until later, but it is like you can buy it at Walgreens or whatever. Now, you are going to have to cut several pieces of it, but the good thing about clear silicone is that when you are in the early stages and you are still worried about, just surveying for spitting stitches or infections or whatever, when the tape is clear, you're able to see those incision lines and still have the benefit of the silicone. So that is a reason why I would use that, is if I was closer to having surgery than further out, okay? Now, the thing about using silicone treatment, and let's just stop and talk about this real quick. Basically, the silicone is telling the body, oh, we already have a nice layer of skin here, so I'm going to stop activating that fibrinogen under there from building more and more collagen to build up and make this scar thick. It signals to the body that there's more hemostasis and that it has enough healing material so it doesn't overproduce it. Plus, it keeps moisture in so that these cells lay down, especially on the exterior, nice and organized and not raised up, okay? And it'll shut off those signals so that especially if you overproduce and you have hypertrophic skin, it'll shut off the triggers, those chemoreceptors that keep saying, make more fibrin, make more fibrogen, make more collagen, make more collagen, make more collagen. It'll shut it off, okay? So there's lots of studies on this. I'll link some in the comments. But anyways, so how we use this after surgery is you want to wait until your wounds have somewhat healed. If you've had a breast lift though, never shower. I always keep this area dry. Try to keep my incisions dry as long as I can, especially if they have the tapes on there, because they can harbor and hold bacteria. Like if you washed your hair and it goes down in there, you absolutely don't want to do this. So I typically tell people to turn their back to the shower, hold a towel over here. That does not mean we don't clean here, like spray. I recommend for if you have tapes, you want to keep those tapes dry because they do hold in moisture, but you don't want it to be macerated in too much. So take a little alcohol and spray there, especially if you've been in the shower and they've gotten wet, to dry those tapes out, okay? Once the tapes come off and we start to use the silicone, this is the way we're going to do it for our breasts. And this is the way I'm going to do it today. Right around the nipple, I'll line up a piece of silicone. I'll line up a piece of tape. I have not taken, it has like a backing on it. I'll line it up, make sure I cut a piece that's big enough to fit my nipples. Fold it in half like this. Then you're going to take your scissors and you're going to cut a small hole in the center, depending on how big your nipples are. Sometimes this is trial error the first time. You'll have a piece like this. So instead of cutting 1 strip, 2 strip, 3 strip, and you're wasting all the rest of this excess, this is like basically you're making your own embrace. You're cutting it, putting a hole in it, and then you're going to put it right over your nipple with the hole in it. It has a little stretch to it. I recommend when you put on silicone, I don't want you pulling on your tissues, pulling it and then putting it on, because you don't want to stretch those tissues out. But this itself will have a little bit of stretch. So if you attach it to the bottom and you need it to be just a little bit bigger, you can pull up just slightly on it and don't create a ton of tension on your breast tissue. Put it over and attach it. One thing I do want to say is I do recommend that you clean the skin with some alcohol first before you put this on so that they adhere well. The studies that have gone on show that this works best the longer you do leave it on. So I put this on first, and then I take it off at about 3 to 5 days, depending. Sometimes they'll get a little yeasty. You know how you get that yeasty smell under your breast if you kept them on too long. So you want to make sure that you're monitoring them. And that you're not seeing any redness or you're having any irritation. If you do, then you need to obviously use common sense and take them off. The next cut I make is I go under this breast tissue here, under the crest, and I go from here to here. Guys, remember I have on this compression bra, so it's kind of hard for me to show you this, but you go from one end here to this end here. You want to go from the edge of your incision to the edge of the other incision, okay? However long that is, you're going to cut this here. And then you don't need this big wide strip to save money. You're going to cut it lengthwise. When you know how long that is and you've cut it here, you're going to cut it lengthwise here. You use 1 tape here, 1 tape here. You also will do the same here. From this circle that has gone over the nipple portion, you're going to take another piece and you're going to measure it down to the bottom where it's going to meet this tape. Remember that you have this tape that runs across here, so you don't have to overlap them, so you can save some tape. You just make it long enough to go from the edge of this one to the bottom of this tape. Okay, so that's basically you're making a T. Cut that piece, same thing, cut it down the center of it. Then you have one for your left breast and one for your right breast. This stuff is amazing. Like I said, I leave it on for a few days. I do, however, still go around leaving it a 1/2 inch margin around it. But if with my oils, because you know I recommend Scar Be Gone and Skin Healing Salve. So I don't use the salve when the tapes are on, but I do use the oil. And so I will leave a margin. So if this is on, with these vitamin E rich oils, I would leave and roll around like a 1/2 inch margin. And why do I do that? Because essential oils are absorbed by the skin. They're under the 500 Dalton mark. So you still get the benefit of the anti-inflammatory nature of these oils. Plus they have a lot of antibacterial stuff in them. A lot of them cover anything from MRSA. There's so much research on them. So you still have some great antibacterial oils in them. And so I still tell people, when you have the silicone on, don't run over the edges of it because you don't want to lose it, but around, just go ahead and roll around and still keep using the oils that you have, so that you're also supporting the healing that's going on under it, okay? Then, after, from 3 to whatever, how many days I can keep them on, I go ahead and take them off. I shower, and then I let them rest. And when I let them rest, for those 24, 48 hours, you guys, I go hard on the oils. I use the skin healing salve. I use the Scar-B-Gone oil. And I will roll on the Scar-B-Gone right on the incision lines, all over the nipples, rub it very well, rub it under the bottom. You're gonna see most of your scarring will usually come here. Some people have a dark line here. I thank God that I don't, but I think it's because I so aggressively treated them from the beginning, okay? So I go ahead and I layer the Scar-B-Gone, and because essential oils will flash off, I use the skin healing salve. Now this stuff is really special because it's got an arnica, St. John's wort, and calendula like macerated infusion in it. And you guys, it's amazing for wound healing. And it helps so that it keeps it hydrated and seals in the essential oils in your Scar-B-Gone so it won't flash off. And like I said, moisture is key, especially once those incisions have closed. Moisture is key to keep yourself from having really bad scarring, okay? One reminder I want to have about why scabs are important. When you see scabbing, do not pick it off, especially if your kid has a boo-boo. Tell them don't pick their scabs, because the scab is, it's the first thing that happens when your body leaks all of that plasma and proteins to the surface. But why it's important is it seals off. It's basically like the body creating its own moisture barrier for the epithelial cells that are stacking themselves under the scab. And so, like we said, they're immature and they will die if it is dry or in the presence of too much inflammation or in the presence of infection. They don't do well and they don't organize themselves well. So you want to tell your kids or yourself, don't pick scabs off. They have a role in healing, and make sure that you're keeping them moisturized with a good salve that you can find. I always recommend try to use stuff that does not have petroleum in it. That's just my own. There's so many that you can find good salves that don't have petroleum that are natural, and there's so many on the market now, you guys. But try not to use ones that are man-made with like mineral oil or petroleum if you can. Does that mean that it'll hurt you? No. It's just my personal preference. I try to find one or use my own because I make my own. So it's all natural stuff. But it'll seal in the moisture so that when your body starts to stack those cells and have re-epithelialization, it's nice and organized and nice and flat, okay? All right, so thanks for coming to my TED Talk today. This is how we use silicone and why it works, and a little bit about wound healing. If you have any questions for me, go ahead and leave them in the comments. All the products I use and the cheaper silicone tapes, I will link in the comments. You guys have a blessed day. Thanks for joining Mom Saving Grace.